Osteopathic Wellness Medicine of Western New York is a holistic muscular-skeletal practice that revolves around your needs. Whether you're an injured weekend athlete or you've got chronic spine and joint problems, the mission is to get you to your best functional level and keep you there in an optimum healing environment. Here to guide us to a path of wellness is Dr. Leonard Kaplan, Osteopathic Wellness Medicine. Thank you so much for being here today.
Thanks so much for having me.
All right, so your practice is taking a unique approach. I'm so excited to learn about how you're treating injuries, so let's get right into it.
Yeah, I'm actually very excited because I've had a major step in my professional career where I feel like I've been missing a piece of the puzzle for many years in treating chronic cartilage injuries, ligament injuries, and that goes for anywhere in the body, whether it's the spine or the joints of the knees or shoulders. And you know, the classic approach is to put a little bit of steroid in the joint, helps the inflammation, can make a person feel pretty good. Unfortunately, as we all know, with long-standing problems, it wears off, symptoms come back.
Absolutely.
So one of the things that we've learned, and by the way, this approach that I'm going to talk about has been around for about 50 years, but it's now finally catching on, is that not only do you have to treat inside of the joint, but you have to treat the external structures of the joint. So for the joint to be healthy and well, when it wears out with age, you have the cartilage breakdown inside, but you have the ligaments that control and support the joint. They start to break down on the outside.
Okay, so the concept of tensegrity, that's what it is.
Exactly. So tensegrity is actually an architectural term, and basically it combines two terms, tension and integrity, so integrity of tension, and our body is stabilized through tension of ligaments that's kind of span these joints. And you may have seen some architecture or sculptures out there where you have beams that are balanced by wires. It almost seems like they're suspended. So the wires provide the right amount of tension and support these seemingly very heavy beams, almost like in a suspended air type of a scenario. And if you take one of those wires out, the entire tension scenario changes and the whole thing kind of crumbles. But when the wires are strong and they're positioned right, you can put a huge amount of weight on that structure and it will support that weight.
So when we talk about the applications of prolotherapy, tell me a little bit about you're regenerating by making the body think that it's not feeling good or that it's injured? So
what you're doing is you're, first of all, very importantly, treating the whole joint, not just the inside. And you're trying to create this concept of, recreate the concept of tensegrity or the strength by putting a very special solution into the ligament, and the solution consists of sugar and some water and a little bit of lidocaine. The sugar is it's a highly concentrated solution, and when it's injected into the ligament, it creates a small amount of injury, which wakes up your immune system to think that there's something is newly injured. The system goes in and tries to repair and repairs the ligament.
Let me look at the graph that shows, we've got just a few minutes, the positive results of dextrose injections. So we're looking at that, and that's showing us how the positive results are of the dextrose. You're seeing much better results.
So this study was published in 2012, and it compared people that had sugar solution injections, therapy, and saline. And you can see the yellow line is the results of people that had the dextrose solution up to 52 weeks or more. Significant improvement in function and pain. Now,
you've also brought pictures of startling results of prolotherapy. Is that how you say it, prolotherapy? Regeneration of knee cartilage, and look at that.
Right, exactly. So the big white arrows are pointing to the space in between, the spaces where the cartilage is. So those are the folks that have received, let's say, 3 or 4 sessions, and you could see some regrowth of the cartilage and increase in space between the joint.
And the ruptured MCL, let's see that.
The MCL is a ligament on the side of the knee, and again, you could see before and after, and again, it's just a simple solution of sugar that promotes regeneration.
This is another search for more answers, and I like the results that we're seeing. Thank you so much for stopping by. I appreciate it.
Absolutely. Thank you.
Very exciting. Dextrose injection results versus a saline solution in physical therapy over 52 weeks. Regeneration of knee cartilage. All of that, you can look into it. Let Dr. Kaplan in Osteopathic Wellness Medicine of Western New York guide you on a path to your wellness and healing. Their optimum healing environment promotes comprehensive wellness care. Osteopathic Wellness Care of Western New York is located in the Harris Hill Office Park at 8612 Main Street, Suite number 1 in Williamsville. For more information and to find out about their spring wellness retreat at the Spalding Lake Clubhouse on May 3rd from 9 to 2, call 626-6301 or go to WNYOsteowellness.com. There's more answers there. Coming up next, Health Systems Services provides the tools to help people with limited mobility live comfortably in their own homes. And they can help you or your loved ones age in place. We'll explain. After that, we'll tell you about the 8th Annual Mother's Day Walk to benefit the Asian Indian Community Foundation and how you can take part in this fun family event. Western New York Living will continue.
This segment of Western New York Living was sponsored by Osteopathic Wellness Medicine of Western New York.